Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hi, I'm Dr. Lisa Hernandez, and welcome to Your Health radio and television show on AM 1240 KNRY and AMP Cable Television 24 and on the web at ampmedia.org. I'll be rotating with Dr. Hugh Stallworth as your host for the show. We will continue to provide you valuable public health information, but we've added a few new features. One is the rotating host, and two is we've added a feature at the last segment where we will address questions submitted by you, the audience, on the current topic of that show. You can submit questions to us through our email at mchd2010@gmail.com. Again, the email address to reach us with questions is mchd2010@gmail.org. Next month's topic will be on traffic safety. April is STD Awareness Month. STD stands for Sexually Transmitted Disease, and it is Awareness Month, and we will be talking about STDs today. Most of us have heard about sexually transmitted diseases. Some of us can even name a few, but it is a topic that most people don't feel comfortable talking about. STDs can affect everyone. It doesn't matter your age, your background, or your what walk of life you come from. The Centers for Disease Control and Prevention estimate that every year we have about 19 million new cases of STD infection, and about half of them go undiagnosed. Therefore, it's really important that we know the facts about sexually transmitted diseases. Today, we will talk to experts in the field about sexually transmitted disease and get information as well as tips about STDs, including how to talk to your partner or your healthcare provider, and also know how to reduce our risk for sexually transmitted diseases. My first guest today is Kristy Meyer, who is Supervising Public Health Epidemiologist at the Monterey County Health Department. Kristy, thank you for coming and welcome.
Thank you for inviting me to talk about this important public health issue.
Thank you. So many people associate sexually transmitted diseases with the free love movement of the 1960s. But when did STDs truly emerge as a public health concern?
Well, I think we certainly became more aware of STDs, or VDs as we used to call them, in the 1960s. However, STDs have been with us for a very long time. In fact, the ancient Greeks actually were the ones who named herpes for the creeping and crawling of lesions. And the Roman Emperor Tiberius banned kissing in public to try to prevent the spread of disease. Gonorrhea, although it wasn't called that at the time, was such a nuisance in Europe in the 1100s that the English Parliament actually had to pass laws against trying to prevent the spread of this disease. And the King Louis IX of France actually banned his subjects, exiled them if they showed symptoms of gonorrhea. Syphilis is another STD that's been with us for a while. Syphilis is often called the great imitator because many of the signs and symptoms, as you know, of syphilis are the same as they are for other diseases. The first epidemic of syphilis, the first recorded epidemic anyway, occurred in Europe at about the same time Columbus arrived in the New World. So these STDs have been with us for quite a long time.
Wow, so public health in ancient times, I see.
Yes, it's been a very important health issue.
Yes. So you've talked about syphilis, gonorrhea, and herpes. What about HIV? how long has that been around?
Well, HIV actually is a relative newcomer to the STD group. Most people associate the emergence of HIV with the 1980s. However, the first recorded case of HIV actually occurred in 1959. Advanced genetic analysis of blood samples taken from that time show that the virus probably mutated from another virus in the 1940s or 1950s and was probably originally a virus that was found in monkeys or primate populations. In the mid to late 70s, physicians in California and New York started noticing an unusual cluster of illnesses among individuals, diseases that normally healthy people with healthy immune systems do not get were showing up in these individuals, as well as rare forms of cancer and pneumonia. And it was this symptom or syndrome of illnesses that became known as AIDS. But it really wasn't until 1983 that the virus that causes AIDS was first discovered by scientists. So HIV is really a newcomer in the STD world.
Great. Well, thank you. Well, what about, so we know a little bit about the history of STDs. What are the most common sexually transmitted diseases that we're seeing here in the country and in Monterey County?
Well, nationwide, human papillomavirus is the most commonly reported sexually transmitted disease in the United States. It's estimated that about 50% of half of all sexually active people will become infected with HPV at some point in their lifetime. Now, in terms of Monterey County, unfortunately, HPV is not a reportable disease. Therefore, we don't know how many individuals are actually infected with HPV in Monterey County. Among those diseases that are reportable, chlamydia is by far the most commonly reported STD in Monterey County, and in fact, it's the most commonly reported infectious disease in Monterey County. We see about 1,200 individuals diagnosed with chlamydia infections every year in Monterey County, and that averages out to about 3 people every day being infected with this disease that we know how to treat and prevent. Now, the second most commonly reported communicable STD in Monterey County is gonorrhea. And although we see a much lower number of cases of gonorrhea, about 100 cases a year, we are quite concerned about some of these gonorrhea cases. We're seeing an increase in certain types of gonorrhea that have become resistant to the antibiotics that we commonly use to treat gonorrhea. So this is quite a concern for us. In addition, untreated or improperly treated cases of chlamydia and gonorrhea can lead to pelvic inflammatory disease. That's often called PID for short. And that the Centers for Disease Control and Prevention estimates that about 1 million women every year in the United States experience an episode of PID. And PID is the fastest growing cause of female infertility in the United States. HIV is another disease that continues to affect individuals within our communities. There are about 600 people living with HIV/AIDS in Monterey County, and that's just those that we know of and that have been reported. We estimate that there are many more.
Wow, Kristy. So it sounds like even though HPV, or human papillomavirus, is really, really common, we don't know how many truly in our county people are affected by it, but it is definitely something that we see day in and day out when you tell us the numbers that we see estimated nationally. And as you mentioned, both gonorrhea and chlamydia are pretty common here in our community as well. And as I mentioned in the intro, these are infections, especially those two, chlamydia and gonorrhea, which people don't necessarily go to get tested for. And it does have an impact when you talk about changes that can affect people's health, even just during that time when they are infected actively, and when it can cause problems later on in life for women, especially when they're trying to start a family, or if they can have other problems such as chronic pain due to the infection. So thank you very much on that information. And so it sounds like we know what some of the most common infections are here for sexually transmitted diseases, but how do we truly get those numbers? How do we get that information about what infections are affecting the community here in Monterey?
Well, unfortunately, we don't have a very good idea about all the individuals who are infected with an STD in Monterey County. Many individuals, especially men, experience no symptoms of the disease. Therefore, they never seek medical treatment for their illness, and they continue to possibly spread the infection. We never know about these cases of STDs. For certain people, they will go see a medical provider, and in that instance, medical providers are required by California law to report certain diseases when they're diagnosed to the health department. For STDs, these include chlamydia, gonorrhea, pelvic inflammatory disease, syphilis, chancroid, and HIV. So if a person does go see a medical provider, the provider is required to report to us some information about that diagnosis. And we use that information to try to prevent the spread of disease. Now, medical providers, it's very important that they report this information to us. And it's important to note that we treat these reports with the highest degree of confidentiality. We would never release a person's name who was infected with an STD or any information that might lead people to be able to identify that person. So what we ask medical providers to do is they report to us on something called a confidential morbidity report form, again emphasizing that confidentiality aspect. And we get information about the date of diagnosis, when the person might have been infected, and also some demographic information about age and gender. We also ask for information about treatment. We want to make sure these individuals are treated properly, and also about their pregnancy status, because we're concerned about that as well. So we take this information that we receive from medical providers and we use it to target preventative programs to individuals who are at highest risk of infection or at highest risk of severe complications for infection. Unfortunately, we think that we only receive reports of about 25% of the STDs that are actually occurring in Monterey County. Because of this and because of the social stigmas associated with many STDs, we often refer to STDs as hidden epidemics within our communities.
Yes, I think I've also heard it referred to as what we see as the tip of the iceberg.
Absolutely.
So we only see that little bit, and when you think of an iceberg, we only see that little small part, and the rest is underneath the water, and we don't see the true impact of these infections on our community. So it's really important that we have people know about information about STDs so that they can get the care that they need, and also for us to be able to have information and programs for people who need to know about sexually transmitted disease and their risk. So talking about risk, who are the people that we've seen looking at data both national and local on who really is at risk for getting a sexually transmitted disease?
Well, really, any sexually active person is at risk for getting an STD. However, in general, the more sexual partners a person has, the higher their risk of getting an STD is. We're particularly concerned about young women. Women under the age of 25, their cervix is not fully formed, so they're more susceptible of getting an STD. We also note that there are certain groups of individuals within Monterey County that seem to be affected by STDs more than others. Hispanics and African Americans in Monterey County are diagnosed with chlamydia and gonorrhea at twice the rate that white individuals in Monterey County are. In addition, men who have sex with men are much more likely to be infected with HIV, and we're seeing this growing trend statewide right now that men who have sex with men are contracting syphilis at a much higher rate than we have seen before in the past. And it's some of these social determinants of health, like lack of access to health care, poverty, lack of educational opportunities, and social stigmas may be responsible for some of these differences we see between the rates that individuals are being infected with HIV and other STDs. In addition, there are certain health behaviors that place us at higher risk for getting an STD. We already mentioned multiple sex partners. Individuals who have had an STD before are more likely to have another STD. Individuals who have sex with commercial sex workers are at higher risk of contracting an STD. In addition, intravenous drug users in particular are at a higher risk of being infected with HIV. Methamphetamine users are at almost twice the risk of getting an STD as those who do not use methamphetamine users, and amyl nitrate users or popper users are also at a much higher risk of getting an STD. So it's certain behaviors certainly place us at higher risk, but it's still important to remember that any person, any age, any gender, any sexual orientation, any income level can get an STD.
Well, thanks, Kristy. And I think also what I want to point out, too, is that from having this information submitted by the doctors and the laboratories about new infections, we get to learn more about what are the changes in the people who are at risk, the communities that are at risk, as you mentioned, with the men who have sex with men and their new risks that we've identified. One of the other ones I've heard, too, which is we're seeing more and more in the data, is that it's not only just the number of sex partners you have, is how many sex partners you have at one time. So these are things that are new bits of information that we can only get from getting the information from the providers when we get those confidential morbidity reports. So thank you very much. One of the other questions, one of the things we want to do is give information to our viewers about what they can do to keep themselves healthy or healthier. So what are some important things or messages that you'd like to have our viewers know about sexually transmitted diseases?
Well, I think it's important to know that sexually transmitted diseases affect more than just our reproductive health. These are important health issues for our entire well-being. Infection with certain STDs make us more susceptible to other diseases. A person infected with chlamydia, a woman infected with chlamydia, is 5 times more likely to be infected with HIV. Also, it makes certain diseases worse, so to say. A person infected with HIV and hepatitis C experiences liver damage much quicker than a person who is infected with hepatitis C alone. We think of syphilis in terms of an STD, but it can actually cause systemic disease as well, causing paralysis, blindness, and dementia. But more than just our reproductive health is at issue here. STDs can cause an economic burden on our healthcare system. You know, healthcare is a hot political item these days. And what we found is that in California, we spend $1 billion every year treating STDs and their complications. A recent study by the Centers for Disease Control and Prevention found that for every dollar we spend on an STD prevention program, we can reduce the incidence of STDs by up to 20%. So it goes back to that old saying, an ounce of prevention is worth a pound of cure.
Well, thank you very much, Kristy. Well, we're talking today about sexually transmitted diseases, and our first guest was Kristy Meyer. Thank you for giving us that information, Kristy. We're going to take a short break.